basically saw pretty easy to manage CAR T-cell related toxicities. The majority of grade 3 and higher toxicities was cytopenias from chemotherapy, right, the fludarabine and Cytoxan. The cytokine release syndrome and neurotoxicity are the main sort of CAR T-cell related side effects. We saw probably about 70% patients had some grade CRS, but only 2 of the 23 patients had grade 3 CRS and no grade 4 or 5 events in CRS, which is great because it's very little aggressive CRS. And then for neurotoxicity, there were about 39% patients who had some form of neurotoxicity, but only 5 that had grade 3 or 4 neurotoxicity events. There were no grade 5 events. So reasonably well sort of tolerated, or I should say very well tolerated CAR T, as far as CAR T cells go, CAR T cell therapy in this situation. There were also some tumor lysis syndrome events, about 4 of them, and that, we didn't see that much of in the lymphoma trial, but when you have circulating abnormal lymphoma CAR T, CLL cells in the blood, there's usually more tumor lysis syndrome risk, like we saw with acute leukemia and whatnot with CAR T cells. So we had 4 events of the 23 that were tumor lysis, manageable with, a couple of them were just manageable with allopurinol and pills. There was at least a couple of patients who may have needed respiracase, and 1 patient who actually needed dialysis as well. There were 2 dose-limiting toxicity events, both on dose level 2, and one was hypertension, severe hypertension actually, which is unusual because we think CAR T cells will usually cause hypotension, but in this case it was very severe hypertension at the end of the dose-limiting toxicity period, so around day 28 or so. And the other case was some neurotoxicity that lasted more than 7 days, so it became a DLT by definition, and that patient also had grade 4 tumor lysis syndrome requiring the dialysis, which made it a dose-limiting toxicity.